Signs and symptoms. Fever is the most common symptom of COVID-19, but is highly variable in severity and presentation, with some older, immunocompromised, or critically ill people not having fever at all. In one study, only 44% of people had fever when they presented to the hospital, while 89% went on to develop fever at some point during their hospitalization. A lack of fever does not verify someone is disease-free. Other common symptoms include cough, loss of appetite, fatigue, shortness of breath, sputum production, and muscle and joint pains. Symptoms such as nausea, vomiting, and diarrhea have been observed in varying percentages. Less common symptoms include sneezing, runny nose, sore throat, and skin lesions. Some cases in China initially presented with only chest tightness and palpitations. A decreased sense of smell or disturbances in taste may occur. Loss of smell was a presenting symptom in 30% of confirmed cases in South Korea. As is common with infections, there is a delay between the moment a person is first infected and the time he or she develops symptoms. This is called the incubation period. The typical incubation period for COVID-19 is 5 or 6 days, but it can range from 1 to 14 days, with approximately 10% of cases taking longer. An early key to the diagnosis is the tempo of the illness. Early symptoms may include a wide variety of symptoms, but infrequently involve shortness of breath. Shortness of breath usually develops several days after initial symptoms. Shortness of breath that begins immediately along with fever and cough is more likely to be anxiety than COVID-19. The most critical days of illness tend to be those following the development of shortness of breath. A minority of cases do not develop noticeable symptoms at any point in time. These asymptomatic carriers tend not to get tested, and their role in transmission is not fully known. Preliminary evidence suggested they may contribute to the spread of the disease. 60 In June 2020, a spokeswoman of WHO said that asymptomatic transmission appears to be rare, but the evidence for the claim was not released. The next day, WHO clarified that they had intended a narrow definition of asymptomatic that did not include pre-symptomatic or post-symptomatic, weak symptoms, transmission, and that up to 41% of transmission may be asymptomatic. Transmission without symptoms does occur. Complications may include pneumonia, acute respiratory distress syndrome, ARDS, multi-organ failure, septic shock, and death. Cardiovascular complications may include heart failure, arrhythmias, heart inflammation, and blood clots. A study published in the New England Journal of Medicine concluded that the risk for severe COVID-19 was 45% higher for people with type A blood than those with other blood types. Approximately 20 to 30% of people who present with COVID-19 have elevated liver enzymes reflecting liver injury. Neurologic manifestations include seizure, stroke, encephalitis, and Guillain-Barré syndrome, which includes loss of motor functions. Following the infection, children may develop pediatric multisystem inflammatory syndrome, which has symptoms similar to Kawasaki disease, which can be fatal.